Hello, everyone, and thank you for joining us so far. We're going to give it just a couple more minutes as people are hopping on here. But if you wouldn't mind typing your name, title, and organization into the chat box, it just helps us get a feel of who's on today's webinar. Again, I will start in just a minute as more people are hopping on. All right, I'm going to go ahead and get started. I already started the recording here. So again, hello, and thank you for joining us on today's webinar. We will be learning more about the Federal Office of Rural Health Policy. The webinar today is being recorded and will be posted to our website. We will send the recording and the slides to the participants at the end of the series. My name is Caleb Lozinski, and I'm the program coordinator. I am a program coordinator here with the National Rural Health Research Center, who's providing today's webinar. Your audio is muted by default to avoid background noise and feedback. Please remain muted unless you have a question. To unmute your line, please select the microphone in the lower left corner of your screen. If you dialed in, press *6 to unmute your line. You can also communicate through the chat box, which is located in the bottom ribbon in the middle of your screen. If you haven't already, please take a moment to type your name, title, and organization into the chat box so we know who is joining us today. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving rural health. The center is a TA provider for the Delta Region Community Health Systems Development Program. The Delta Regional Authority and the Health Resources Services Administration, FORHP, have partnered to support the DRCHSD program. The center is committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is valued. You may learn more about our commitment on our website. Now, I'm going to go ahead and pull up some pre-polling questions like we do on all of our webinars. It just helps us get a feel of knowledge gained on these types of webinars. So we have our wonderful Suzanne Snyder, who is joining us today and will be presenting. Suzanne Snyder is a public health analyst in the Hospital State Division at the Federal Office of Rural Health Policy. She's a program coordinator for the Delta Regional Community Health Systems Development Program and a project officer for the State Office of Rural Health Program. Suzanne has a variety background in social services and community development, from case management and counseling to program coordination and community assessment. I will go ahead and turn things over to you, Suzanne.
Wonderful. Thank you so much, Caleb. It's such a pleasure to be here. One question I have is, am I able to share my screen at this point with the slides?
You should be able to forward it along. Do you see the forward icon?
Yes, I do. Okay, perfect. That is awesome. Okay. Let's see. Hold on, folks. Technology issues. I'm not an expert when it comes to technology. Perfect. Okay. Yes, it should work now. All righty. Well, it is awesome to be with y'all this morning. Appreciate your patience with me, my technology issues. But I am lucky enough that I get to be the program coordinator, as Caleb said, for the Delta Region Community Health Systems Development Program from the Federal Office of Rural Health Policy. So every day I'm working with all of the wonderful folks from the center that y'all have come to know and love, just to make sure that this program is running smoothly and that it's as absolutely supportive to you all as it possibly can be as participants in the program. With that in mind, I do want to take a moment to thank you all so much for your commitment to participating in the program. I know it takes time. I know it takes a lot of energy and dedication, and it's really, really appreciated. We've seen some awesome outcomes, so I just encourage you to keep up the awesome work and always let us know if there's ways that we can be better supportive to you all in the work that you're doing. So the purpose of this webinar today is to provide a bit of an orientation to the Federal Office of Rural Health Policy, or FORHP for short. You've likely heard about us either through the Delta TA program or otherwise, but you might have questions or may not just fully understand our role in the work that we do. So I'd like to first walk you through our structure just a little bit. Then I'd like to break things down a little bit further into the resources and the programs that we have that might be of interest to you all. And I want to share resources for you kind of throughout our time today as we go along, and then attempt to leave some time for questions at the end that I may or may not be able to answer for you, but I certainly will do my very best for you all. So getting started, first step here is to walk through, like I said, our structure just a little bit. So the Federal Office of Rural Health Policy, or FORHP, is housed within the Health Resources and Services Administration, or what we call ourselves HRSA for short. HRSA is located within the U.S. Department of Health and Human Services, alongside some of our perhaps better known sibling agencies like CMS, the CDC, or the FDA. And HRSA is kind of known as the access agency. So we are the primary federal agency responsible for improving access to healthcare and building health systems for folks who are geographically isolated and or economically or medically vulnerable. And so to accomplish that mission that we have over 90 different programs. We have more than 3,000 grantees, and we serve tens of millions of Americans in the programming that we have to ensure that they have access to care and that they're receiving quality and affordable healthcare and other services. So HRSA programs help those who are in need of high quality primary healthcare, people with HIV/AIDS, those who are pregnant, families, of course, folks who live in rural communities, among other focus areas. And we also support the training of health professionals, the distribution of providers to areas where they're in most need. So again, rural areas in particular, and we support improvements in healthcare delivery. So here is HRSA's organizational chart so that you can kind of see the offices and bureaus that come together to accomplish this work that I'm speaking about. I've highlighted FORHP on here in that kind of red box, just so you can see where we are alongside the other 17 offices and bureaus that are kind of combined to create what we know as HRSA, and work in a variety of different areas, with FORHP being kind of that focus on rural programming within the office. So now breaking down FORHP a bit, FORHP was established in 1987 under Section 711 of the Social Security Act to serve as the focal point for rural health activities within the Department of Health and Human Services. And so we play two distinct roles within HRSA and within HHS. The first is a statutory charge we have to advise the Secretary for the Health and Human Services on rural health policy issues, especially when it comes to interactions with Medicare and Medicaid programs. And so in that way, we can serve as a voice for rural to help folks understand the unique needs of rural compared to urban, recognizing that rural is just not a small urban community, but is very unique. And the second role that we play is we administer grant programs that are focused on supporting and enhancing healthcare delivery in rural communities. So by locating both of these functions in the same office, it's really great because we can use our policy role to inform the development of grant programs to make sure that they're really in touch with the needs of rural communities. And then we can also use our grant role to provide a community level perspective when we're assessing the impact of policies from the Health and Human Services on rural areas. We draw on our expertise from both of these different roles to serve as an HHS and a government-wide resource when it comes to rural health issues. And we're really, really intentional about cross-agency collaborations, trying to work with other federal partners to strengthen rural healthcare access overall. And everything that we do, we're seeking to expand access, to enhance rural health capacity, and to improve rural quality. So within FORHP, we have 4 distinctive divisions that you can see on this slide to accomplish the work that we do. Our divisions include the Hospital State Division, the Community-Based Division, the Policy Research Division, and the Rural Strategic Initiatives Division. And you can see some of the programming or names of programs you might be familiar with within each of those divisions on the slide here. Some programs provide funding directly to communities, some provide funding to states, and some support policy analysis, technical assistance, or research. But the common thread that you can see across all of our divisions in our programming is that we're supporting rural communities either through direct funding, through technical assistance, or through information. And in thinking about the presentation today and what is most relevant to you all as providers, hospitals, clinics, instead of breaking down each of the divisions to talk about what they focus on, I thought what might be more relevant would be to focus on what all we do that can support you regardless of what division of FORHP it's coming from. So to that effect, across FORHP, what we can provide for you through our programming can typically fit into the 3 buckets that you see on the screen here, whether that be technical assistance, resources that you can access that are totally free to you, or grant programs that either you can be a part of, you can apply for, or that you might be able to share with other folks within your community, other partners that you have. So that's kind of how I'd like to walk through the work that we do for y'all. I hope that this is helpful. I'd love your feedback at the end or later to hear if this kind of design makes sense for the work that we do. So first is technical assistance. So we provide technical assistance and support to rural hospitals and clinics through a variety of different programs. The first and most important that I wanted to mention to you all on a state level is your State Office of Rural Health, or SOAR, as we call them. Each of our 50 states has a dedicated State Office of Rural Health that is funded by us. And it's designed to support rural providers, communities, organizations, stakeholders by sharing information and resources, by coordinating with partners on rural health issues and coordinating activities that are happening across the state, and by providing technical assistance and linking folks to federal and state resources. And they also support workforce recruitment and retention. Many of the state offices are also 3RNet members, so they can provide technical assistance for that as well. 3RNet is the National Rural Recruitment and Retention Network, if you're not familiar. If you have not already, I would highly encourage you to connect with your state office, utilize them to ask questions, find resources, and provide feedback on what is happening in your community, because they're really here to support you all. We have regular calls with them, with each state office, to understand the needs and the challenges that you're facing. And to be honest, this feedback is really what guides a lot of our programming. So I'd really encourage you to connect with them and to share. I have included a link on this slide where you can find your state point of contact, but I will add that I happen to be the project officer for many of your states, your state offices of rural health, and I'd be more than happy to get you connected in if needed. So feel free to reach out to me as well, and I'm happy to connect you with whoever the folks are at your state office of rural health. From there, we also have a lot of other types of programs that are designed to provide technical assistance to rural providers and rural organizations. 2 programs that you might be very familiar with, they're at the top of the slide. It's the Medicare Rural Hospital Flexibility Program, or FLEX program, that provides technical assistance for critical access hospitals. And then the Small Rural Hospital Improvement Program, or SHIP program, for hospitals with 49 beds or less for operational improvements. So we fund these programs and we work with your states to make sure that they're running well and they're supporting you and your rural hospitals. We also have some programs that support our grantees by providing technical assistance or data collection and evaluation. So you can see Then we have programs that support the SOAR, Flex, and SHIP programs. So this is helping to ensure that states and grantees have the support that they need to implement these programs and support you all if you happen to be a recipient of any of those funds or that technical assistance. And then we have programs that provide direct technical assistance or support to hospitals. So this is where the Delta TA program comes into play. We do have 2 other programs that also provide technical assistance to hospitals and clinics, but I'll just let y'all in on a secret here. The Delta TA program is the only one that's specific to the Delta region, and it is likely the most intensive and supportive. So know that you're in the right place if you're in the Delta TA program, but also know that we do have other technical assistance programs for hospitals and clinics that's open to across the nation. Still technical assistance, but a bit different from the Delta TA program is the new Rural Emergency Hospital, or REH, Technical Assistance Center that we fund to support hospitals and, thinking through, is REH right for them? Does it make sense for them organizationally and for their community, and then helps them through that process of that transition. Something else that you'll see here is a program called the Rural Health Value, which is really more of a resource for you rather than technical assistance, I'd say. It's a website that has all kinds of information, models, and tools when it comes to transitioning to value-based care. And I do have links on this slide whenever those slides become available to you for you to take a look at. So speaking of resources, we can dive more into what we offer for you all. Many of these come out of our policy research division that does a lot of work in analyzing the possible effects of Medicare and Medicaid policy on rural communities. And they also provide technical assistance to folks across the Department of Health and Human Services. But they also support a number of resources with the goal of making sure that health policy information and resource is truly accessible to rural stakeholders and that it's framed through a rural lens. So first up here is RHI Hub, or what that stands for is Rural Health Information Hub. So RHI Hub serves as a clearinghouse for rural health issues, and the goal is to help rural communities to navigate the various opportunities that are out there and the resources that are available to support their residents. If you have never checked out this website, as soon as this webinar is over, or as quick as you can, please go take a look at it, because you are going to find just a wealth of resources that are at your disposal. The website is ruralhealthinfo.org, and you will find tons of different topic guides, toolkits on various different focus areas you can use. They also highlight different funding opportunities that you can engage with, which, to be honest with you, I think can sometimes be a little bit easier to navigate for funding opportunities compared to grants.gov, because they have different search features that you can find opportunities by your state or by topic. And they also include not just federal funding, but also state or other local funding sources. You can also find really great information on interesting program models and innovations across the nation that are working in rural America that you can try out for yourself, or might just spark ideas, brainstorming, things like that. Also on that note, RHI Hub gives you the opportunity to gloat just a little bit about awesome things that are happening in your community. I hear every week about the awesome work that you all are doing, from the center folks, especially when it comes to your community care coordination work. And so I would definitely encourage you to share your story, your model, your innovative ideas and success stories to RHI Hub to share with other rural communities looking to do something similar. We have featured Delta TA participants before in their publications, and I personally would love to see you all everywhere. So just want to make sure that I mention this opportunity to share your story on that website. So now getting into more research resources that are at your disposal. FORHP's research program is the only federal program that is dedicated entirely to producing policy relevant research on healthcare in rural areas, studying critical issues facing rural communities and seeking to bridge the gap between policy and program needs. And so part of that is in the funding that we invest in conducting rural focused health services research through our rural health research centers. And then we make that research available to rural stakeholders, including you all, through the Rural Health Research Gateway. That can be found at ruralhealthresearch.org. And I think I've seen Kate pop some helpful links in there. So I appreciate Kate, you doing that for me. If you are looking for research, whether it be for pulling a grant together, a grant application, if you are trying to find information that you want to share with your community, whatever it may be, I really would encourage you to take a look at this website because it is completely free. It's meant as a free resource to you all. Okay. So now on to grant programs. We fund a variety of different grant programs across all 4 of our programmatic divisions, and I want to highlight those that I feel are most relevant to you all today. So this slide here gives you a sense of what areas of concern our programs cover. We seek to build capacity, we seek to expand services, we support hospitals, and some of our grant programs provide direct services. All our divisions cross these different areas, and some of our grant programs kind of touch on several of these different focus areas. Overall, I have a couple high-level things that I want you to keep in mind as I start to talk about some of these grant programs. Some of our grant programs are very specific with a certain intended purpose, but what you're going to find with much of our community-based grant programs is that they are designed broadly so that you can meet the needs of your community. And these programs typically fall into 2 areas, either being capacity building focused or direct service focused. The second thing that I think is important to note is our community-based grants, the greater majority of them tend to have a network or a consortium requirement, where you either have to be developing or have already developed a network with 2 or more healthcare service providers or partners. So this is something you want to really think about in your CCC work in Delta TA. If there are grants you know that you want to be prepared for, just thinking through how to start forming those partnerships or what that might look like for your community and your organization. And the last thing, high level, just want to say before diving into programs is there are many pilot programs that often come through our office, and they're often really targeted for folks like yourselves at that local level, hospital or clinic, to engage with, or come together with your community partners to engage with. So I have included quite a number of programs on this slide. I hope it's not too much. I know it's a lot of words you're seeing on your screen right now, but I highlighted or bolded a couple that I really want to bring to your attention because I think that they're probably most relevant to your organization or your community, and you could very well apply for these opportunities, for your organization yourself. So 2 programs you might be familiar with if you've been seeking FORHP funding in the past is our Rural Health Network Development Planning Program and the Rural Health Network Development Program. These are 2 of our kind of long-standing programs we've had in our office for years upon years. Starting with the Network Development Planning grants, they are probably one of the very best grant programs for you to take a look at out of all the programs I'm going to talk about today, because they are wonderful in helping you get started in forming a network of your own that could then lend itself to some of these other opportunities where there's a network requirement or consortium requirement. These grants promote the planning and development of integrated rural healthcare networks. The major focus of the network planning grant is to support multiple, so that's at least 3, rural healthcare entities that have not previously collaborated in a formal manner, but want to work together and form a healthcare network. So the grant program supports 1 year of planning to develop and assist these healthcare networks in becoming operational. These grants are typically $100,000 for 1 year to get yourself up and running. These notice of funding opportunities are what I'm going to call NOFO, here forward, come out every year. So highly encourage you to look into this if you look into nothing else that I talk about today. To that effect, we actually have a NOFO out for it right now. The application is due January 26, 2024. And we have a TA or technical assistance webinar coming up on Tuesday, November 14th, 3:00 p.m. Eastern Standard, for those that are interested in learning more about this funding opportunity and what the application process looks like for this. Even if you don't feel like you're in a place where you're ready to apply, if you happen to be free Tuesday, 14th, 3 p.m. Eastern, I'd attend it so you can get a feel for what these HRSA technical assistance webinars kind of look like for notice of funding opportunities, and to get a feel for what components there are to applications for our funding. These are recorded, so if you can't make it on the 14th, there should be on the notice of funding opportunity, there should be an email for the contact at FORHP you can reach out to get the recording of the TA webinar. Highly, highly encourage you to take a look at this though. I see a request for sending the meeting request. I believe that Caleb might have sent the link for that. It should be a Zoom link for the webinar, but if you're having any difficulty with that, feel free to reach out to me afterwards and I can get you connected with that. So from the network development planning grants, that kind of then feeds into our rural health network development grants. These come around every 4 years, and these grants are for when you have that network up and running, recognizing how important those networks are for healthcare service delivery and system reform. This is funding to support your network in improving access by addressing gaps in care, workforce shortages, better workflows, or improving the quality of healthcare services. This is funding for expanding capacity and services, for enhancing outcomes, and ultimately for sustainability of your network. It will likely be a couple of years before this one comes around again, because like I said, this runs on kind of a 4-year cycle, but this is another one I would really encourage you to keep an eye on. The ceiling amount from the most recent notice of funding opportunity was $300,000 per award. So it's a little bit of money there to kind of help you once you have that network up and running to be able to tackle gaps you have in service, or a variety of different things, maybe when it comes to workforce or things like that. Another one I wanted to mention that I've have highlighted on here, bolded, is the Rural Healthcare Services Outreach Program. It's one of our staple programs as well. This is a very flexible community-based grant program that is aimed towards promoting rural healthcare services by enhancing healthcare delivery to rural underserved populations. Funding can be used for quite a broad range of healthcare services. That's why I wanted to highlight it. It's based on the demonstrated community need that you have. Very flexible. There is a consortium requirement with this. In the most recent notice of funding opportunity, there was a ceiling of up to $200,000 to accomplish this work. And over the years, we have seen project focus on social determinants of health. We've seen chronic disease management and prevention, care coordination, telehealth. We've seen dental care, behavioral health, quite a variety of different projects that can come out of this, because like I said, it's just very flexible funding. This grant typically has a 4-year period of performance as well. We're anticipating a notice of funding opportunity around coming out for this program for fiscal year 25, meaning that the NOFO would likely come out in 2024. So I'd encourage you to keep an eye out for this if this sounds of interest to you, and if you've already got a network or consortium up and running that could apply for this. I also bolded our rural communities opioid response programming on here, but I'm going to go more in depth on those programs a little bit later just because of how extensive they are. So from there, I've also bolded our newest Delta Focus program that many of you might be familiar with at this point, the Delta Health Systems Implementation Program, or what we're calling DSIP. So this program provides funding to support critical access hospitals and small rural hospitals in the Delta region that have received previous TA through the Delta TA program or another similar TA program to implement projects that will improve their financial stability and allow for increased access to care in rural communities. These projects will focus on financial and operational improvement, quality improvement, telehealth, and workforce development. So this program offers an opportunity to build on the work and the progress that you all achieve while you're in the Delta TA program, or other folks who are in other similar TA programs that are in the Delta region, to further implement recommendations from your TA consultations with the independence and the responsibility that comes with, federal grantee after you've graduated from the Delta TA program. We have just started the very first project year for 5 grantees in this program, and all 5 of them are coming from the Delta TA program. They're all graduates from Delta TA. And all 5 of them with this NOFO received $404,000 to implement their projects. Really, really want to highlight this as an opportunity for you all as you're graduating and you have accomplished a lot. You've implemented a lot of best practices, but you've got other things left, from those action planning sessions, other things that you'd like to implement. Again, whether it's financial, operational, quality improvement, telehealth, or something that's connected to workforce in some way, and you just need a little bit of extra funding to make it happen. Really want to highlight this program for you all as a great opportunity. We anticipate a NOFO coming out for this program again in early 2024. So for those that are graduating, or if you're close to graduation, this is definitely something for you to keep in mind. And then the last program that I highlighted here is the Small Healthcare Provider Quality Improvement Program. This program supports planning and implementation of quality improvement activities for rural primary care providers or providers of healthcare services. The program objectives for this program include increased care coordination, enhanced chronic disease management, improved health outcomes for patients. This is another 4-year period of performance grant. You're hearing a trend here, aren't you, with 4 years? It's kind of a standard that we have with many of our grant programs. The last awards that were made for this were at $200,000. Critical access hospitals, RHCs, FQHCs, and networks of small rural providers are eligible applicants. A network or consortium is not required, though it is highly encouraged for sustainability of care. Unfortunately, where we're at with the grant cycle right now, we likely are not going to see a NOFO for this program come out again for a couple more years, but just another program for you to be familiar with and have your eye on when the time comes. So, moving on to a couple other programs that might be of interest. One I wanted to highlight that I did not include on the previous slide is our Rural Residency Planning and Development Program, or RRPD program, where we are seeing a lot of success in creating new rural residencies. The concept of the program is to provide support for the startup costs that are associated with establishing new rural residency programs, like accreditation costs, faculty development, and resident recruitment. With the most recent NOFO, the funding was up to $750,000 for these startup costs, and the goal is that these programs will ultimately be sustainable long-term through stable funding mechanisms like Medicare, Medicaid, and other public or private funding sources. So you'll see here that we've supported 58 grantees across 6 medicine disciplines so far. Going in, we were expecting mostly family medicine and internal medicine, but we have 7 that are focused in psychiatry, and we have our first ever rural general surgery rural training track that we're working with right now. One of the primary goals of this program is that by the end of the grant program, they will have applied for and received accreditation for their new rural residency program, and thus far 26 of our 58 are now fully accredited. And another goal is that programs must start training residents the following academic year, which our grantees have been very successful with thus far. Already 22 programs have enrolled 190 resident physicians, which we're hoping that these physicians will ultimately stay and practice in these communities, as studies suggest. We also have a TA provider that works with this program that offers free resources and tools and many key topics related to rural residencies for grantees that you can check out. That website is ruralgme.org, and I can link that later if I need to, so that we all can access those tools and resources. So the reason I'm bringing this up is because of who the recipients can be for an RRPD grant. RRPD award recipients are quite diverse, not only geographically or in the communities that they serve, but also in their organizational structures, you can see here. You'll see that rural hospital and critical access hospitals on your screen. 5 of our RRPD grants were awarded to critical access hospitals, all of which are partnering with a sponsoring institution to train physician residents. The types of rural clinical training sites can vary from RHCs to FQHCs, facilities operated by critical access hospitals. Overall, across our grantees, there's roughly 17 clinical training sites that are critical access hospitals. So just wanted to make mention of this program because it might be relevant to you, whether applying for this program alongside an educational institution or potentially being a clinical training site. And we are forecasting a NOFO coming out for this program again sometime this fall. You should be seeing it probably in the next couple of weeks, I'd expect. And then I would be remiss if I did not mention the Rural Communities Opioid Response Program, also known as RCOR, within our office. This was first launched back in fiscal year 18. And it is now a suite of programs that was developed to really address this crisis that we're seeing across rural communities when it comes to opioid use disorder and substance use disorder. The focus with this program is addressing those behavioral health needs through direct funding and through technical assistance services for rural communities. So at the time when this first started, we thought that this was going to be just a one-time award, but it has received additional annual funding every year since, and it just continues to grow. It has become the largest appropriation of our office's history. We're in 47 states, 2 territories. We're reaching over 1,800 rural counties and providing direct services to more than 2 million rural patients through the culmination of all of this programming. It's expanded, like I said, into what is now an umbrella of programs. We have planning grants, implementation, medication-assisted treatment expansion and access, psychostimulant support, behavioral healthcare support. I know earlier this year we had a grant for adolescent and youth behavioral health support. And the key to this programming is that the community really gets to decide how services are implemented. The amount of funding for each of these programs varies, and you'll see that the NOFOs are specific to the program areas and what the program is seeking to address. I would really encourage you to take a look at these programs if your community has any opioid or substance use needs, as we have NOFOs coming out for these programs all the time. I will caution that these programs and this funding can tend to be quite competitive, as you might imagine. But if it sounds like this is something that your community really needs support with, then it really might be worth taking a look at these or taking a look at opportunities to partner with other community organizations to seek out this funding. Last, for programs, I did just want to mention something that our RHCs in the room here might be very familiar with, which is all of the RHC-focused COVID-19 funding and programs that came out of the pandemic. In an effort to expand access to vaccines, to ensure equity in COVID-19 response in rural communities, HRSA more broadly worked with RHCs across the nation to strengthen vaccine allocation and confidence, to expand COVID-19 testing and mitigation with just a whole suite of programs that came through our office. If you're an RHC who participated in any of these programs, just want to thank you personally for working with us and helping to get more folks tested and get information out there to your folks in our rural communities. If you're interested in learning any more about these programs or you need resources that were connected to any of these programs, then you can check out the webpage linked on this slide. It's from HRSA's website, where you can find information on each of the programs, just from basic facts to more detailed scenarios and examples to help RHCs plan and implement programs. Okay, so to finish up a bit here, if you are not already receiving our FORHP weekly announcements in your email inboxes, please go to the webpage that you see on the screen here. It is HRSA.gov/subscribe. These announcements are always jam-packed with resources, funding opportunities that we have open, information from our partners, and other rural healthcare matters. They are released every Thursday, and it is just a really great way to stay connected with our office. And in particular, I think keep an eye out for funding opportunities that are coming through our office. So highly encourage you to subscribe. And lastly, I just want to encourage you to consider becoming a HRSA grant reviewer. It might sound like a strange ask, but we are always looking for folks who have experience in and an understanding of rural healthcare. And it's a really good opportunity to learn more about the grants process here at HRSA, I think. I've often heard from folks that becoming a reviewer has really helped them to become a better grant writer and have just a better understanding of that process of writing a really well-developed grant application. So if you happen to have the time, it would be something to, I think it'd be worth it to take a look at. You can find information on the application process and answers to any of your FAQs, any questions you might have at the website that is listed on this slide. So with that, you will find my contact information here on the screen. Again, it's just been a pleasure to be able to be here with you all today and walking through FORHP just a little bit. I am very far from being an expert on anything, really. I'm learning more every day, but I just think it's really important to get this information accessible because as someone from a small town in North Carolina, it's hard to get information sometimes from my perspective. So I just want to ensure that you all have this, and if nothing else, you know where you can learn more, and that you have my contact information if you've got questions. The folks at the center are phenomenal, and they might be more of an expert than I am, if we're being totally honest. So I know that they're also there as a resource, but I'm here for y'all as well. If you have questions about grant programs, if you're having trouble finding information on a certain topic, if you have a question when it comes to grants.gov, you hear about a grant opportunity, but you're not quite sure how to get to the information you need on it, then I just want to be here as a resource to y'all as best as I can. So with that, I will take any questions that you have. Not sure if we have anything in the chat, but I'm pretty laid back, so feel free to come off mute if you got questions or put it in the chat, whichever you're most comfortable with.
Yes, we love questions, and thank you, Suzanne. Please, anyone, if you have any questions, feel free to type them or come off mute. As we're looking for questions here, I'm going to go ahead and launch that post polling. Again, just helps us measure knowledge gain on today's webinar. But yeah, anyone have any questions? Shoot them out.
While y'all are thinking about all your hard-hitting questions that you're going to throw at me, let me show you just a little bit at the end of this presentation that I think Kate just shared in the chat. Of course, we've got just kind of, again, general HRSA contact information and stuff here. But at the very end too, I added 2 appendices. First is a funding opportunity forecast with just a couple of grants that we're anticipating coming out soon, or kind of within the next fiscal year or two, or a year or two. Just wanted you to have that table for your reference. And then the second appendix here, if I can get to it, it's just some additional resources that I thought, let me just throw them in here in case it might be helpful to you. We've got some more general HRSA grant resources and trainings. If you're interested in telehealth, I linked some helpful information and resources that we know of, at least, on the federal side, or partners that we work with that can give you some resources with telehealth and cybersecurity, workforce resources, and the opioid response programming that I mentioned earlier. We do also have centers of excellence that we fund that have just a ton of resources that are at your disposal if that sounds like something of interest to you.
Got a question coming in from Doug Tanner. OB services in rural Alabama are quickly disappearing. As of 11/15, our facility will be one of only 16 hospitals in Alabama's 54 rural counties providing maternal health services. What resources could be most helpful towards our sustaining our OB?
Really great question. It is definitely something that we have our eyes on. There's been a lot of conversation about OB services right now because of the deserts that we're starting to see. It is a serious need. I know not just in Alabama, but Alabama in particular is a state that we've been talking about lately. We do have one program within our office called RMOMS. Let's see if I can remember what that stands for. Rural Maternity Obstetrics something. And that looks at kind of building networks in rural areas to support OB services. To my recollection, it's the only program within our office that focuses specifically on OB services. We just had a NOFO out for that earlier this year, and I believe that that grant funding has been awarded. But we're really right now looking at other ways that we can help support OB services. We're looking at working with other federal partners to kind of come together to support these issues that we're seeing. More recently, we're having some conversations with USDA when it comes to maternal health. If there's ways that we can kind of come together with partners that we have, or just with funding, braided funding opportunities to be able to support OB services. Doug, what I'll do for you is let me see with our Maternal and Child Health Bureau at HRSA, let me see if there's any kind of funding opportunities that might be supportive to your organization. I'm not super familiar with the different funding opportunities that they have. They might also have resources or technical assistance to support you. So I'll come back to you and see what else I can find for you on that. And thanks, Kate, for sharing the RMOMS link too. Doug, that'll give you more information on that program specifically, just to kind of give you a sense of what work within FORHP we're trying to do with OB services.
Yeah, and as we're waiting to see if there's any other questions, I just want to pop in here too. On slide 20, Suzanne was talking about the Delta Health Systems Implementation Program. And I just want to do another call out to encourage all of you, when that becomes available, we'll be sending that information to our Delta sites who are eligible to apply for it. And that'll be the sites who have graduated or are in their last year and will be graduating this next year. Because as Suzanne had noted, this last round, we had Delta sites that applied for it, and all 5 awards were given to sites that had completed the Delta program. And that funding was $404,000. So it is an amazing opportunity to keep working on some of the activities that you had started in the Delta program and to keep progressing with those. So we'll be sending all that information out, but I already want to just to preemptively prompt you that to take advantage of that opportunity and make sure you apply.
Thank you, Kate, for highlighting that. I'll just add too, she's so right. Some of the projects that we're seeing with these 5 right now include cybersecurity and telehealth implementation, EMR. We have folks that are looking at quality improvements that had some lingering things after Delta TA that they just want to bolster up a little bit further. We have someone that's looking at some financial improvements, some financial operational improvement. And we've got someone looking at workforce too. So that program was truly developed out of the Delta TA program, seeing the great success coming from organizations that have participated in Delta TA, and seeing an opportunity where we can just continue to further support sustainability for you and your organization. So once that notice of funding opportunity is out, you're probably going to hear a lot from me, because I'm going to try to promote this as much as possible. This funding was truly designed for you all. So thank you, Kate, for that extra push. Appreciate you. Any other questions, thoughts? I know I kind of threw a lot at you, especially with the grant programs to keep on the radar, but definitely take a look at the slides. When you have an opportunity, feel free to reference them. If something sounded interesting and, you know, weeks, months down the line, a project comes in mind that you could use some funding for. Well, I am hearing none, which I hope is a good thing. Hopefully you're not totally overwhelmed with everything I just threw at you. But I really mean it when I say, feel free to reach out if you've got questions. I've been in my role for close to 3 years now. And prior to this, everything I've done has been nonprofit work. And I just know it is really, really hard to navigate. Well, what's right for me? What out of your resources or programs are meant for me? Or what can I apply for? Or what have you? It is my personal mission to try to make things accessible and to make sure that when you have questions, we can get that information to you. So truthfully, I mean it. Feel free to reach out if you have questions or are wondering about funding that might be out there for you.
Well, if there aren't any more questions, we can give you back 10 more minutes of your day. This recording and these slides will be posted to our website shortly, and I will send the links out after Thursday's webinar. So again, thank you everyone for joining us, and we'll see you again on Thursday, same time.
Thanks, y'all. Appreciate you.
Goodbye, everybody.